Morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with Henryford Health System, St. Joe, Oakland, and Beaumont. The theme of our Health Talk today is ketamine-assisted therapy. Joining us as our guest speaker is Dr. Cassius Drake and Jacqueline Drake, and both of them are going to talk about the healing power of creativity and more. So this is a very interesting topic today, and I want all my viewers to listen to this and view the wonderful painting that she has brought from her studio. So good morning, Jacqueline. Can you give your introduction, first of all, to our viewers?
Well, thank you again for having us back to talk about ketamine and the ketamine-assisted therapy that we offer at our center. We have been in practice now for a little over 2 years.
2 years? Okay.
And we've been treating patients with a medication called ketamine, and we give that in a shot in the arm. And the patients end up having an incredible experience when the whole, I would say, the experience is done. And they end up they see and have an incredible experience, and they see wonderful things and do wonderful things and find the healing within themselves. And part of what we really love to do is the integration part. And the integration, we feel, is very important when it comes to psychedelic integration, because that's where the changes start to happen within people.
Okay, so now, good morning, Doc. Can you give I know you are the director of this therapy clinic, so please give us your introduction to our viewers.
Sure. So good morning, Dr. Prasad, and thanks for having us back in the show. It's always fun to be here. I'm Dr. Cassius Drake. I'm the medical director and co-founder of the Drake Center for Transformative Healing. And as Jacqueline was sharing with you, at the Drake Center, we provide ketamine-assisted therapy and integration as part of our process of treating depression, anxiety, and PTSD. We're excited to talk about what we find is a very unique and special aspect of our clinic, which is our focus on the healing power of creativity. And as part of our process, after our patients have had a ketamine treatment, they have integration where we talk about the experience or give them the opportunity to creatively express their experience, which is Jacqueline's passion and speciality. And we have some very special art today that our patients have created based on their prior experience.
Yeah, so that's good. Now, later on, we'll talk about the dose of ketamine, but let us start with Jacqueline. Yeah. Can you show us your beautiful paintings that from the individual patients and tell them, explain to them?
Yeah, so after our patients go through a series of our treatments, a lot of the integration that I work with them with is literally getting them to create, and creating for the purpose of healing. And what comes out of that and where their creativity comes out in is always
like a dream, what is in their dream.
It is somewhat like a dream. Somewhat like a dream. There's a lot that happens, obviously, in a ketamine experience, but we really focus on getting them to create it out. And I have a background in getting people to create in all different areas of art. So I usually meet them wherever they are. If they're a writer, I meet them there. If they're a musician of any sort, I meet them as well there. I do a lot of work in virtual reality, and we also create in virtual reality also. And then there's some times where I get my patients to actually create on canvas, like my own art, and they love that. And that's what today is what I brought in. So some of these pieces are from their healing. And it's a beautiful experience to watch them go from, from having some trying times in their life to getting to the point where they're feeling better enough to create again.
Right.
And we really utilize the creative process for the healing.
So when you're going to project this, can you just mention the age? What's the age of that particular person? So I don't want to know too much detail, but just their age.
Yeah, for sure. I can show you.
Yeah.
So
let us start with the first one.
I brought in several paintings, and some of these are, I can say, patient diagnosis.
Yeah,
So as they work through depression or PTSD or even anxiety,
right.
They once we go through the treatments, they're able to express it out. And I let them use all sorts of mixed media that I love to use for my own art. And so some of these paintings become incredible because it's so unique for their own.
So it's a very nice, wonderful painting.
Yeah. And so for this one,
how old is she? What did she come?
This was a woman, I want to say in her late 50s.
Late 50s?
Yep, and came to us for anxiety and depression. And just kind of, in a place in her life where she needed to do a little bit of work and find herself again. And in that process of finding herself again, she literally saw a door.
Okay. Beautiful.
So, that's just one example of things. There's also, I have an example of this painting, actually.
Yeah.
This is pretty incredible. This was a PTSD experience that she really has worked through. And, these become so transformative to them, what they see in the ketamine experience, that some of these images become just part of them. And even some of them, I actually have a rule, not to get a tattoo shortly after they see their things.
Let me ask you a question.
Yeah.
The thing on the top, does it mean it's more like a scary feeling with the PTS?
Actually, in this particular painting, it's really fascinating. It kind of looks like that.
Yeah.
But it actually ended up becoming more of an empowering thing for her.
Okay.
To release and let go and really be empowered by that.
Big power.
But she let out what was troubling her, let's say. So in that case, this is the after. But in the all over feeling, and I usually work with feelings as well.
Yeah, what feelings she has.
Yeah, and so this was the release of that particular patient. And then there are some patients that have incredible other kind of experices where they feel free and light. And in this particular case,
and
this
the
was a
beautiful
younger
flowers.
Yeah, and this was a younger girl. And when I say younger, we see patients 16 and older. 16 and up. But so this was a teenager, and she painted an incredible thing, what she had seen in her experience, and that was feeling lighter and not so heavy, let's say, of emotions, and being able to dance in the clouds with flowers.
And, showing the sunshine, like she's ready for a brighter future, right?
Exactly.
Am I right? Whatever was initially her issue, she's thinking positive and thinks that her future is more bright, right?
Yes.
So those are very good. Do you have any comment before we go further?
I think that what those paintings represent is a physical representation of the transformation that's happening to people within this process. And there's a lot of talk in the use of ketamine-assisted therapy and what's the best ways to use it, and do you need to do coaching or integration or support, and at the Drake Center we profoundly believe that ketamine-assisted therapy should be done with coaching and guidance and support, and with that coaching and guidance you can see the beautiful outcomes that can come from just supporting people and really having them take a deep dive into, yes, you had this interesting experience, but what did that really mean for you? And what can you take from that that's going to have long-lasting meaning in your life? And what shows up on that canvas is the result of that profound change that's happening in people.
So before you start, Doc, on the treatment, first of all, you will evaluate, the patient from the medical point of view, right? Make sure they don't have their underlying disease. I mean, this is what, as a physician, we do,
Right.
So they when they go to your center, what do they expect first?
Yeah. So our process begins with what we call our intake session. Well, after an initial conversation with the patient, they will meet with us and we'll get their backstory and, of course, take a good medical history, make sure that they're healthy enough for the treatment.
Yeah.
And we'll begin that process of building a roadmap for their journey at that time, of figuring out, where are they trying to go? What's the North Star for their experience? And then following that, they'll have a preparation visit with me, where we'll talk about the logistics of the day, and we'll begin the process of really setting their mindset and some goal setting for their treatment. Following that, they come to the office and they have their ketamine treatment at our office in Franklin. Our office was once Jacqueline's art gallery. It is a fantastically beautiful
art gallery.
and
Itself going there, it perks up your mood, right,
Yes.
Jacqueline?
It really does.
it's just a beautiful environment for the whole experience.
Yeah.
So they come there and they have the injection in the office. We sit with them the whole time. We even have a therapy dog that's there in the room if they want to pet the dogs, and make sure that everyone's very comfortable. Patients can have someone sit in the room with them if they like. And we give them injection. They have music and a comfortable chair. We observe them during the experience, and then when it's over, we talk to them about it. And begin the process of how did that feel for you, and what you can begin to do to make that a long-lasting part of your life. While some people have very profound change just at that point, or others, it takes a little time. Not to say it may not settle in until we have our conversation the next day, or when they sit down with Jacqueline and paint it out, and they'll have that. Those ahas. We've started calling our patients our butterflies, because they really are different people, different beings by the time they're at the end of the treatment.
How long does it take for you to do one painting?
It all depends. It depends on each It depends on each patient, each experience.
Okay.
Like I said, some patients like to paint a painting every single session they have. And we recommend 6 treatments at a time to start off. And so some of them like to paint it out. Some of them like to wait to the end, and we do one big painting at the end.
Okay, so it
all really
depends upon the individual, right?
It depends on the individual and where they are with their own creativity. And I kind of try to meet them where they're at.
Yeah.
And I just know the creative process. Once I get them creating again, it's the process itself that is the healing. And so getting them to, of course, create out what their experience is, but there's far more to it than just getting one little painting out. It's giving them a lifestyle of creating for a different purpose. And that is to be able to get back into that headspace of where they find a little peace.
Yeah, so this is great, so they know their talent.
Yeah.
It's mostly to let them know that they have some talent, even though right now they have some post-traumatic syndrome or anxiety. They know their talent, and just looking at the painting, it makes them feel that they can do better, right?
Yeah, absolutely.
So
and I
that
think,
is the whole idea of the therapy. Okay.
Yes, absolutely. And that's why we bring in all these different modalities of healing.
Yeah.
I also teach a lot of mindfulness and meditation with our patients because that also helps them manage their anxiety and manages their stress levels in between in between the actual ketamine sessions. So it becomes an incredible healing experience when our patients come to us.
Yeah, because
from all different ways.
For the teenagers or children or even adult, anxiety and depression is the main thing we have right now going. So many things have been done, behavioral therapy, psychotherapy, and everything is being geared towards their mental depression, right?
Yeah, and we're seeing a lot more now. And I don't know if it's the way the world is, I'm assuming, but there's a lot more
Yeah.
anxiety out there. There really
Huge
is.
need.
The-
A huge
Do you
need
see
for
more
this.
because of the post-COVID era? Or?
Oh, yes. I mean, we see a substantial number of long COVID patients
Yeah.
who are still struggling with brain fog and ongoing
Yeah,
depression. I mean, let's face it. I mean, the whole populace
Yeah.
is essentially traumatized by the whole experience.
Right,
There's a lot
yeah.
of unprocessed
Yeah.
emotion out there.
Yeah. The brain fog you mentioned, that is a very interesting thing you mentioned about the brain fog.
Yeah, and ketamine, theoretically has potential to improve that through neurogenesis, and it's often described as a reboot of the brain, and we found it to be very effective in that sort of sparking energy of consciousness again.
So once they see you and you are done with this, do you put them on a long range therapy with this?
So after they've done their initial series of treatments of 6
Yeah.
treatments, we have patients that will come back and do boosters, and that's really as needed.
Okay.
And the frequency of boosters can be as often as a month or once a year.
Okay.
And we have some patients that do fine and never come back. And they're out living their lives and they're doing great. And
Really? Well,
fired
that is
their
good.
psychiatrist and got off their
Fire,
antidepressants.
that's very good.
We've had a few of those.
Yeah, we've
not
had
that,
quite a
not
few
that
of
we
those.
suggest that, but that's
Yeah.
we've had a
No,
few of
we've
those
had a
that
few
felt so
people.
much better.
Right.
Yeah, well, we've had some that just felt so
Yeah,
much better
yeah.
that that's what they do.
So then after that, they can see their psychotherapist and they can still be maintained on some
Yes.
anxiety medications
Absolutely.
that are in the market, right?
And our goal is, our goal is to build people's resilience to life, basically.
Okay.
We don't say that you'll never be afraid again or you'll never have a sad day again. But we do find that people don't sink as far as they used to. Or
Okay.
they when life happens to them, whereas before they would sink into the pit for weeks or months,
Right.
they have a bad day and they bounce back,
Bad
which is
day.
normal. You're being a
Right,
normal
yeah,
human
they have-
being.
right.
And so building that resiliency to life we found to be profoundly
Yeah.
effective.
So this is very interesting to know, Yeah, this kind of kick-assisted therapy is. So, and then what ages are you seeing at your
see-
office? What age group?
Our age groups are, even I've been thinking about this actually a lot. Between age and demographics, it's all over the map. There is there's no specific
No
demographic
specific.
or economics. It's everyone needs a little help right now.
So almost
it's-
any
we're seeing
age-
all ages and all
Yeah.
races.
Maybe
and-
start from the adolescent,
Yeah, we start from 16 and up.
Yeah.
16 and
16
above.
up.
And it's
Okay.
an equal opportunity treatment. There is no one that this doesn't affect.
Yeah.
There's
Absolutely.
no age, class, education, race. This hits everybody. Everybody needs this.
Yeah, yeah.
Yeah, for sure.
So then after you do this therapy, do you encourage them to get into some kind of music,
I do.
like piano and any?
I do. I love
Because music play a significant role, like if you're depressed, we listen to the music,
I encourage all creativity, especially dance,
Yeah,
dancing,
dance.
and anything physical that you're moving your body to.
Yeah.
I work a lot in virtual reality with meditation and creativity, but I also do a
Yeah,
lot
I was
of
going to ask you, that was my next question about the meditations.
yeah. So I do a lot of meditate, show people different ways to meditate, and that's kind of how I've always used immersive therapies, which is VR, and which is virtual reality, and I've used that for art and meditation because it's a whole different thing for me to do a guided meditation with our patients. And a whole nother thing for me to put them inside of one. So it's a little different. But it's an incredible experience regardless. And we're seeing incredible results. Yeah. So,
Yeah, it's very important these days, the role of meditation, music.
absolutely. And
Yeah.
combining all of that really works for the all over creative healing and just being able to give people something else to get them back to the feeling that they need to be in.
Right.
Not the headspace of
Give
worries
them
and
back
fears.
what they need, right? Yeah,
exactly.
because these people, whoever seek for help, they are already depressed. There are so many types of depression, as you know. It could be simple anxiety. It is. There could be even more, and especially during post-COVID era, it was much, much more. Yeah.
Yeah, definitely.
So all those things, and there's also a role of social media, as you know.
Yeah. So
There's a lot of role of social media. But
social media is definitely, especially with teenagers, it's sort of one of those things. It's a blessing and also a curse, I think, for
I know.
emotions, because I actually have talked a lot about this with some of our teenagers, because we actually have 2 teenage boys as well. So
you do? Okay.
Social media is in our house a lot.
Social media in your house.
All day long.
Yeah,
so, but it's also
amazing. Their cell phone will never stop.
No.
Exactly.
They are sitting, eating, click, click, click.
We can hardly get patients to get off the cell phone and get their treatment.
They were like, okay, put your phone down over there.
You should do something about that. Think about this in future. Something to stop them using the cell phones.
There's that. But
They will sleep with it. They wake up with this. Going to school.
I talk a lot about mindset with our patients, and that, mindset has a lot to do with, what we put into our brains, right?
Mind-body syndrome. Yes.
And really what we're compounded with all day long is sometimes a lot of negativity. So I always have my patients kind of look at really mindset, and really, where is our minds? Where is all of our attention going all day long? Is it on the scroll feed or what?
I did a lot of research, reading, studying about mind, what goes in the mind of these people, these adolescents who do the violent behaviors. And I was surprised how many articles have been written. But the most important one, that I found was this little amygdala that sits in the hypothalamic area that is responsible, for your behavior, that controls. And, I forgot, what is that area? Somebody asked me. I said, Doc, what is that area? And I forgot. So then I went through the Gray's Anatomy, back at medical school. And I got a whole picture of the brain where that little thing
Yes,
is.
the amygdala.
Little teeny thing.
That's where ketamine works.
Yeah, ketamine.
That's when it's people often ask, well, what is it doing?
Yeah.
And it
Ketamine
really
works.
it goes to those root foundational emotions that find themselves in the amygdala or in the limbic system,
Right.
where people get. Well, that's where PTSD lives.
Yeah.
So the emotional memory of trauma lives in the amygdala and in the limbic system, activating the fight or flight system.
Those are the neurons.
And so we find that patients will have their treatments, and at the end of the treatment, they will find themselves experiencing how it feels to not be in fight or flight, to have their amygdala actually be relaxed for the first time since their trauma.
Right,
and it can be a profoundly transformative experience for them when they finally feel how it just feels to be safe, secure. Patients will wake up and they'll say, I haven't felt peace like that ever in my life. And then they finally know how it is to be calm. And then our work is, here's how you stay there. And here's why you may want to stay there. And we'll have conversations about all the reasons why people find that challenging.
Yeah, that little thing controls the emotions, anger, and people who have the post-traumatic syndrome, like those who go to the war and all that area is already not functioning. So the most important...
Functioning too much.
Or functioning too much.
It's too on.
It's too much.
It's too on. And so you have to
control.
You have to convince it. It has to be firmly convinced of a different reality. As far as someone's traumatized amygdala is concerned, they're still back in the middle of that thing that happened. And then a ketamine treatment or some other psychedelic treatment comes along, and they have an emotional experience finally of how it feels for that to be over.
Yeah.
And instead of like, I wish that I was healed, or I wish that I had peace, or I wish that I could feel calm, they actually do.
It does.
And then the memory of that sticks with them. And in our integration process and everything we do with creativity is about strengthening that new emotional place so they can stand there long term and don't have to come back and see us.
Right, yeah. So that hyperactive behavior is related to the overfunction of that amygdala.
Yes. Right. So that's, it's
Violent behaviors are right
It's
there.
often described as the reptile brain, right? So, I often describe it if you've ever had a reptile for a pet, a lizard or something like that, you'll know that once a reptile brain has encountered trauma or a threat, it never forgets it. And it will never go back to that thing. So if you have a pet lizard and you hurt it, it's not going to trust you anymore.
No.
It's almost impossible to change its mind about that. And so in humans, the amygdala, the limbic system can be like that.
Yeah.
It can get stuck in a traumatic memory.
Right.
And to get out of that is the thing that psychedelics like ketamine or psilocybin, they work in that place, at that root, to shift that emotional reality. No, I'm not still being traumatized in this moment.
Yeah.
This is actually a different time.
So that's very different. That's very good, interesting thing you said, like a reptiles.
Yes, that's what we're treating. It's that
we are treating the reptiles.
the foundational root of the brain where emotions live is where psychedelics.
Yeah, so that's very good. Now, what are your final thoughts? 1 minute each.
Goodness. My final thoughts. Well, my final thoughts are on creativity, really. That's where my heart lies.
Think positive.
Yeah, well, think positive.
Look at the sky.
Yeah, exactly. There's a lot out there. When it comes to the healing aspect of this, it really is in the integration. To be honest, it really is. I mean, you can have psychedelic experiences. You can take anything. There's lots of things out there that you can take to have this kind of experience. But if you're not guided and directed in this, you're really just playing in the psychedelic playground, as we call it, right? And so we really focus on utilizing that experience to help heal.
That's good. And final thought, 1 minute from you, Doc.
I guess,
we can tell the reptile story.
Sure, my final thought is,
reptiles.
I share with people often that I was an ER doctor for about 20 years.
I know, same like me. Both of us were in the same boat, right?
Yes, and so, in that time as an ER doctor, there were many, many lives that, I led a team that saved physically many lives. And this work that we do now,
it's much more relaxed.
So much more
relaxed.
It's less, not so much relaxed, it's more rewarding. We
more
feel like we're
rewarding.
actually making change in people. And we feel like we're really accomplishing long-term change more than band-aids. And I never had a patient, an ER patient, actually send me a letter and say, thanks for saving my life. No one ever did. But I have had patients in this work send me letters saying, thanks for saving my life.
So that's good, because working at the emergency room stressed me out a lot. You see all the sick patients. So I like to thank both of you for coming to my show. And the topic was ketamine assisted therapy. I'd like to thank our viewers for watching us, my producer, cameraman. And until I see all of you again, we have a safe, wonderful winter and coming spring, right?
Yes, let's
followed by summer.
Yes, think positive.
Think positive.
Thoughts, right?
Think positive.
Yeah.
Thank you again.
Thank you so much.
Thank you.